Management. Step 1. Lifestyle modifications. Diet. Low glycemic index diet, rich in fruits, vegetables, lean proteins, and whole grains. Exercise. Regular physical activity to improve insulin sensitivity and promote weight loss. Weight management. Achieving and maintaining a healthy weight to help regulate menstrual cycles and reduce androgen levels. Step 2. Medical treatments. Oral contraceptives. Combined hormonal contraceptives to regulate menstrual cycles and reduce androgen levels. Anti-androgens. Medications like spironolactone to reduce hirsutism and acne. Insulin sensitizers. Metformin to improve insulin sensitivity and help with weight loss. Fertility treatments. Clomiphene citrate, letrozole, organodotropins to induce ovulation in women seeking pregnancy. Step 3. Surgical treatments. Ovarian drilling, laparoscopic procedure to induce ovulation by destroying a small portion of ovarian tissue. Complications of PCOS. Infertility due to anovulation, metabolic syndrome, increased risk of obesity, insulin resistance, type 2 diabetes, and cardiovascular disease. Endometrial cancer, increased risk due to prolonged unopposed estrogen exposure. Mental health issues, increased prevalence of anxiety, depression, and eating disorders. Prognosis. Long-term management. PCOS is a chronic condition that requires ongoing management and lifestyle adjustments. Early intervention, early diagnosis and treatment can help manage symptoms and reduce the risk of complications.